Good morning, everybody, and welcome to our webinar. We will give everybody just a minute to populate in from the waiting room, and we will get started right at the top of the hour. All right, good morning, everyone, and welcome to the Professional Ambulance Association of Wisconsin's webinar on the new OSHA proposed changes. We are thrilled to be spending the next hour with you and appreciate your time and attention on this important topic. Before I turn it over to Scott Moore, HR and Operations Consultant to the AAA and Principal of Moore EMS Consulting, I would like to address a few housekeeping items. First, this webinar will be recorded and available on our website within 24 hours of the live session. A link to download the slides was available in the 1-hour reminder email you all received from Zoom. And I'll also be dropping the slides into the chat for download as well in case you missed that email. Please use the Q&A box, which is the double dialogue icon near the chat icon, to submit questions to Scott during today's presentation. We will answer as many questions as possible and follow up with any additional questions or unanswered questions via email. If you think of any questions after this webinar, feel free to email them to us at admin@paw.us. I'll also drop that address in the chat box. With that, I'll turn it over to Scott.
Well, hello, everyone. I hope you are well. Thank you for joining us for this incredibly exciting OSHA webinar. And while you can sense probably the oozing sarcasm in my voice, it is not super exciting, but really is incredibly important. My name is Scott Moore. I know a fair number of you recognize a lot of the names here on the list, but I'm a longtime EMS, 34 years in EMS, 21 as a lawyer, and have been working with the American Ambulance Association now for a little over 8 years, actually 8.5, 9 years now, as their consultant, sort of doing all things employment, OSHA, and HR related. So, as I always start every presentation off with a little bit of please don't trust anything or rely on anything I'm about to tell you is legal advice. I am not admitted to practice law in Wisconsin. I am in Mass, Texas, Illinois, the federal bar, but not in Wisconsin proper. So if you need a lawyer, I'd be more than happy to help you connect with one there. What we're going to do just over the next hour, and it is going to be a little bit like drinking from a fire hose, because when it comes to the amount of regulatory language that they put out over the last couple of months, there's just no other way around it. That being said, we will be offering additional educational content regarding this as it works its way through the rule process. As you know, the rulemaking process can be lengthy. So as we learn more and get more information and start to understand sort of what the shape of this rule is going to look like, we will furnish you with additional education and resources. So I just want to talk a little bit about sort of history of the rules governing EMS, then the history of this current rule, the stated justification or why they're doing the rule, and then we'll go through the rule itself and leave some time for questions. So many of you are aware OSHA is the administration. It's also the law, the Occupational Safety and Health Act, but it's also the Occupational Safety and Health Administration. They are the folks who are charged with governing workplace safety for, and depending upon your state, but in your state, for any private or non-governmental employer. So they established the safety rules and injury reporting and tracking, so forth. So the act, of course, has been around since 1970, and really the goal is to ensure that workers or employers are furnishing a workplace is free from any known hazards, and sort of known hazard can be any hazard that could have been learned, even though you may not actually know about it. You constructively know about it because had you performed a workplace investigation, or based upon the types of injuries that your organization experiences, et cetera, those are ways in which you can identify what those rules are. So the goal, really, OSHA's primary goal, is in education, and rather than enforcement, they would rather do education and ensure that folks sort of are doing the right thing, because again, no one wants or needs or benefits from an injured employee. Now, This is just a quick look at sort of what the law is governed. So just the light colored states here, which your state is surrounded, by the way, by other states that have OSHA approved state plans. So the light colored states are the states that are governed by federal OSHA. The medium blue and dark blue states are those states for which OSHA has approved a state level plan. So in some states, they decide they want to draft their own OSHA regulatory language and their own plans. But what OSHA says is, hey, we're the floor. Federal OSHA is the floor. You're welcome to create the ceiling. That's perfectly fine. But what they said was, if you're going to have your own plan, then you are going to have to cover state, municipal, county, and government employees. So in any of the medium or dark colored states, government and municipal employees are covered. Now, in the very dark blue states, those are states that have just adopted a plan as it relates to municipal or government employees. For all the other employees in those states, so I know we were just doing one of these for South Carolina. There were providers from non South Carolina states on there, so there may be one or two from non-Wisconsin employers. In those states, they're just, for the dark blue states, those folks are covered by federal OSHA for the private employers. So just as a quick looking through here, you can see Wisconsin, again, set aside right in the middle of all of those other states that, in fact, the OSHA rules cover both municipal and governmental employees. Now, I say that because even if you are a Wisconsin municipal-based employer, what I will tell you is just recognize that you are being measured against all of those folks who you compete with, which are folks from Minnesota, Iowa, Michigan, et cetera. So truthfully, if those are the standards across the country, you can pretty much count on the fact that people have that, in particular, employees have the expectation that you're going to be following those basic rules. So OSHA announced they've been working on this rule. I believe what I initially heard was 2015, but actually I've heard it's even longer than that they had been working on this rule for about 14 or 15 years. They finally sort of published, or they announced that they were going to publish in the Federal Register a rule sometime in January, and they put out the pre-published version back on December 21st of 2023. That pre-published version was 608 pages of regulatory language. And if you've ever seen the pre-published version, it's usually triple spaced. So it kills a lot of trees to sort of put out what ended up being in the Federal Register 253 pages in the Federal Register, which, by the way, that's like, that 8-point font that you need reading glasses on so that you can see all of it. 253 pages in the Federal Register is a lot of regulatory language. Why? Well, they hadn't updated the Fire Brigade Standard, which was published back in 1980. They hadn't updated that in 44 years. And so, as you would imagine, a lot has changed in firefighting and EMS in 44 years. Hell, 34 years ago, when I started in EMS, we were putting mask trousers on people and killing a whole bunch of folks. Not intentionally. We thought it was good care then. A lot has changed. And so as a result, OSHA, frankly, and if you want my opinion, a lot of it has to do with the pandemic. They noticed how many care providers and emergency responders we were losing, either through COVID or through the mental health and wellness part of COVID, where they were like, we're done, we're not doing this anymore. And I think they recognized that there was a need to establish updated protocols, or updated rules. So this new rule, it's the Notice for Proposed Rulemaking, which the NPRM stands for, covers emergency responders, firefighters, emergency medical services organizations, technical search and rescue organizations, so not non-technical, right? So if you're an EMS agency that is out walking around in the woods just trying to find someone because there's a missing person, that's not technical rescue. What we're talking about are trench rescue, high angle rescue, that kind of stuff. Technical rescue, search and the dive teams, for example, would be a technical rescue. These rules apply to them as well. And then skilled support workers, and I'll explain what that is in just a minute. But these are folks who are actually not our employees. But we, as emergency service organizations, are going to have to provide some protection for them as well. Now, the really sort of two major categories of people or employers who are covered. One is the workplace emergency response employers, which are manufacturing or other businesses that have their own emergency response teams within them. So these are usually, typically, not at all uncommon for like General Electric. My father worked for 39 years, had its own ambulance at one point, and then eventually got rid of the ambulance, but still had their own firefighters and had their own on-plant emergency response teams, first responders, EMTs, who would go and start care before the private ambulance or the municipal ambulance got there. These employers are covered by this standard. So if you have an employer in your market, let's say it's Mercedes or a chemical company or a large scale manufacturing plant that has their own emergency response team, those employees in the emergency response team are subject to these new rules. The other group of people that are covered are the emergency service organizations, and these are folks who provide as their primary function emergency service. Now, a lot of people ask this, well, geez, a fair chunk of the EMS in this country are generally covered by volunteers. Well, the way OSHA looks at this is that volunteers are not employees because they're volunteers. So federal OSHA says volunteers not covered. Now, there are some states who have the state approved plan that specifically include volunteer employee or volunteers who are not employees, but they specifically include volunteers. It's my understanding that Wisconsin, federal OSHA state, that volunteer agencies not covered, right? So the skilled support worker, this is the person whose primary function is not emergency service, but let's say, for example, there's been a building collapse and you need a backhoe operator or a heavy equipment operator to come in and help with removing the debris so that you can try to rescue people. Those folks, we would be responsible to ensure their safety. So for example, folks in 9/11 who were heavy equipment operators who were often taking in a lot of those particulates and that dust, right? Those carcinogens. We are then responsible for these folks. So in the example of a tow truck driver, if we had a tow truck driver who, let's say, was helping secure a vehicle that was dangling off a bridge, we would be obligated as emergency response organizations to make sure that we were providing or caretaking that person to ensure that they weren't unnecessarily exposed to risks associated with that emergency support skilled worker function. Okay, so this is one of those times where it's going to be important that you're sort of thinking about this, and we'll talk about how you can start to wrap your brain around it here in just a second. Really, why are they drafting the rules? Well, OSHA determined that there was a significant risk of material impairment, death, or injury to employees based upon their data collection. So, we have been in the ambulance industry, we have been collecting data on costs for some time. Well, as many of you know, OSHA has been requiring the electronic submission of injury data, the summary data, to OSHA now for a couple of years. Well, they are now, for some organizations, depending upon size, requiring that you're submitting actually injury-specific data. Data is like trash. If you're going to collect it, but you sure as heck better know what people are going to do with it. I can guarantee you that part of these rules are tied to, hey, we're getting more information and more data about what kind of risks, injuries, and illnesses people serving in an emergency response organization are experiencing. And so as a result, they're like, we're going to regulate to try and prevent or protect from that. These include things like, not surprisingly, in the couple of years following COVID, exposures to bloodborne and airborne pathogens, other occupational cancers and diseases. That's the fire side of it is really very, very heavy. Just so you know that there's a huge chunk of this tied to fire departments, and as a result of the occupational cardiovascular and cancer risks that firefighters have as a result of being exposed to combustibles. There's a huge behavioral health component and general physical health, as well as they at least reference exposures to violence in this standard, but they are working on a separate workplace violence standard. And in particular, they already have a lot of resources out there for healthcare, but they are working on a separate workplace violence standard, which they say will probably be coming out within the next year. Why? Well, we know with the general population being, really, frankly, unhappier than they've been in years, especially as we lead up to another election, what they are seeing are more and more workers are being injured by assault and other violent activities. So they are going to come out with a standard on that. We'll keep you posted as we move along. Now, one of the things that OSHA did here was they incorporated reference 22 NFPA standards. So what does that mean? It means that in the states where fire municipal organizations, or if you happen to be, there are private fire departments around, if you are a non-municipal fire department, well, then they have incorporated 22 NFPA standards. Now, what does that mean? That means that anytime the NFPA standards in the future changes in the future, it will automatically change the regulation because they have referenced that NFPA standard. Now, most of those standards have to do with personal protective equipment, turnout gear, exposures to combustion, products of combustion, etc. So I'm keeping this, though, primarily in the EMS side of things because, frankly, we could spend another whole hour on the fire side. As I said, that is actually the 608 pages of in the orange binder that I had on my desk and in fact, it's in the back corner now. I will tell you, I've read this thing now probably 10 or 12 times, and there is a lot of information to get in there. So just as a high overview, they require a community vulnerability assessment, and these are employers that these these emergency service organizations conduct a community vulnerability assessment. We'll talk more about all of these. A risk management plan, medical and physical requirements, training, pre-incident planning, standard operating procedures, and then post-incident analysis. So the community vulnerability assessment, every single covered employer, so this is every private, for-profit, not-for-profit, or non-governmental EMS agency or fire agency, will have to conduct a community vulnerability assessment. This is the process of identifying, quantifying, and prioritizing any potential hazard. These are hazards that you could have known of had you conducted an assessment. This includes not only structures, it can include infrastructure. So if you have a quarry and it's probably likely that that quarry is filled with water, kids are going to jump into it. What do you have to do? You have to do an assessment around, geez, what would our response to an injured swimmer in the water involve? Right? This would include structures. Fire departments tend to do this a lot. If there's a building that's unsafe to enter in a fire, they just paint a big red X on the front door so that arriving fire crews don't start to go into the door and fall through the floor. If the building's not, it's not habitable. Now, fire has it a lot easier because a lot of times they're doing inspections. We, as private EMS providers, don't always have that access. What I would say is, this is one of those instances in which you're going to have to work with your community partners. Now, if your fire group has done it and said, hey, those are buildings we can't go in, well, then you can say we've consulted with our fire partners, and these are buildings that, frankly, we should not be entering in because they are unsafe for occupation. Now, you're going to have to do this throughout your whole service area. This includes, are there inhabitants or areas? New York City, I know that many of the FDNY EMS folks tell us that, geez, when we go to certain projects, we'll get glass bottles thrown down on us, right? Those are things that you are going to have to do an assessment around so that you can prepare your folks and protect them. All right, so it's any hazardous condition. If you have a Superfund site in your area or a chemical company that could pose danger to your folks, you have to let them know. Now, this assessment includes both human-created vulnerabilities, but then also natural ones as well. If you have a dam or something else like that, those are places where you have to be cautious. If the weather or exposures are an issue, if you're in high heat or low temperatures, well, then again, those are community vulnerability assessments that could lead to the injury of your people. It is an incredibly broad piece that they haven't really yet sort of defined more clearly, but just to give you an idea, that is what's going to be required. You will have to develop a written risk management plan. This is a plan that is documented, and it really is taking a look at all of those risks associated to the activities that your folks may do. Now, if you're a workplace emergency response employer, so you're one of those chemical companies that has your own emergency response team, this vulnerability assessment is really tied to your facility, not per se the community as a whole, unless, of course, there are risks that your employees may be exposed to because of the environment. But generally, this risk management plan is going to be you looking at the community, drafting a plan around, geez, these are the risks associated in our community and even in our own facility, that we're going to identify what those are, come up with a plan. In a moment, we'll talk about an emergency response plan. There'll be training, vehicle operations, both emergency and non-emergency. Operations at emergency incidents, not only that, but non-emergency activities, activities that lead to exposures and other incidents-related hazards. So, for example, based upon the likelihood of occurrence, the potential consequences, basically, what can people do as risk control techniques? And then, of course, a post-incident evaluation. Now, you are going to, once you've drafted that risk management plan, you have to have what's your emergency response plan. And in this instance, you have to involve your folks. Now, by the way, in any of the documentation you create, you are going to have to post that and maintain it for at least 5 years. So, and when it's amended, you're going to have to notify your folks, hey, we've amended the plan and we've reposted the new one. So you are going to have to involve team members. These include things like walk-around inspections, encouraging reporting of safety concerns. So if your folks are constantly responding to an area and they're finding that it's getting more and more dangerous, you want to provide and encourage people to report that to you. Hazards, injuries, near misses. So if your folks have like, geez, we've been wheeling the stretcher out of this hospital and there's a little divot there in the thing, we almost had a stretcher tip, that there's a way to report that so that nobody else does that as well. And you, of course, has to post those emergency response plans in a conspicuous location. So one of the things that you will do as a result of that community vulnerability assessment, though, is also identify, well, what are the basic physical and behavioral health essential, both medical and behavioral health conditions that must exist so that our folks can safely perform their duties without risk of injury to themselves or to others. And once you have identified what those are, you are identifying them based upon their level in the organization. So if you've got someone who's out in the field versus someone who's working in the fleet department versus someone who's working in dispatch, you're going to need to identify what those physical and behavioral health requirements are, sort of minimum requirements to be able to safely perform the job. Now, many of you do pre-hire physicals now, but just so you know, moving forward, what you're going to have to do is a medical evaluation with an ongoing surveillance. And that medical evaluation basically is based upon, again, the level of the service that the team member is providing. And then it's an evaluation that is to determine what condition do they need to be in order for them to perform their job without any adverse health effects. This also includes the fitness for the use of particular PPE. So, as I said, a lot of times with PPE, we talk about fire. This also includes any of our employees using N95s or PAPRs or any of that kind of stuff, or other PPE. So it could be Tyvek vests, etc. Tyvek vests. What good would a Tyvek vest do? Seriously, Tyvek suits. And then that these people are evaluated by a physician or other licensed healthcare provider at no cost to the employee. Now, what do these evaluations include? Well, a significant medical work and personal medical history, a cardiac and respiratory evaluation, including also musculoskeletal systems, spirometry, assessment for heart disease, including blood pressure and cholesterol levels, heart disease risk factors, and other tests is deemed appropriate by the physician or licensed healthcare provider. So many of you already do a medical evaluation, but you probably don't have them draw blood to check cholesterol or have them do a spirometry test. These are things that you're going to have to do under this rule. Now, one of the things that OSHA listed in their sort of frequently asked questions, or there was an ancillary document that they published. They said, look, we're really looking for more information from people. We want to know, did we include enough in the physical and mental health evaluations, or did we include too much? And if so, why? So this is one of the things that we're working on right now, is to try and get people to start submitting really thoughtful comments about, hey, if you're in fact doing an evaluation right now, how much more, check with your licensed healthcare, so your occupational or your occupational health provider or your urgent care center. Hey, if we added spirometry and cholesterol levels, what will that cost us? But you're not only going to have to do it at higher, you're going to have to do it every 2 years thereafter. So why? Because they want to make sure that these people continue to be physically fit enough to do the job, right? And make sure that there aren't factors that are adversely affecting their health. So again, a comment that we will likely be including in our formal comment from the AAA will be, hey, many of our members already do an initial physical health assessment. However, adding the spirometry and cholesterol will add an additional X cost per person, plus having to do these every 2 years will add, let's say it's an additional 100, 200, $300,000 per year, depending upon the size of the organization. Now, you will also be required, excuse me, to do behavioral health, not evaluations. You have to have behavioral health resources available to your folks. Now, many of you already do through EAP through the AAA or EAP through your short-term disability provider. You may have behavioral health resources available through your employer-sponsored health plan. These have to be at no cost to the employee. Now, they can be community resources. So they could be an EAP that's available through your public health. They could be stuff that's available through other counseling. Now, I want to caution you about CISD because that's not always considered counseling, or, it is, in fact, a critical incident stress debriefing, but it's not always run by actual licensed counselors. So it may not be considered enough. We don't know yet. We're waiting to hear from OSHA. But what they are going to require that you are publishing these resources and on an ongoing basis, and then anytime after any potentially distressing or psychologically stressing event. What that means yet we don't know. But these resources have to include diagnostic assessments, short-term counseling, crisis intervention. You have to say, hey, how can you access these? And then again, anytime there's something that's called or considered to be potentially traumatic, which we don't know, depending upon the person. We have some of our salty folks have been doing it a long time and they don't see something as traumatic, and other folks who, when I ask them to do a checklist, they believe that I have really personally affronted them. So what I would say is that this is probably pretty significant, will need to be formulated. From a lot of organizations, these resources are relatively sort of informal. Now, you will be required to have a health and fitness program. You will also be required to, in fact, appoint someone to oversee that health and fitness program. What's the point of the health and fitness program? To ensure that responders are able to develop and maintain a physical fitness that allows them to safely perform their job at their level. All right, you're going to have to do periodic fitness assessments. That's no less than every 3 years. You will have to do some sort of assessment. Now, they've said the assessment can be performed using your standard job duties. So, for example, hey, we're going to make you carry someone down a flight of stairs in the stair chair. We're going to make you carry a stretcher or load a stretcher. We're going to make you have to do a backboard carry. Whatever it is, you can do the fitness assessment that way. But one of the things that they are requiring is that you provide opportunities for exercise during working hours that could, whether you put up a gym in your place or whether it doesn't require a gym, you can just have a yoga class, or you can allow them to do push-ups, pull-ups, sit-ups, whatever. That's fine. You don't have to necessarily have equipment, but you do have to have a fitness program and give them an opportunity to do fitness during working hours. Now, I think that they're probably thinking primarily about your typical fire station that's got a gym in it, and that you're giving the opportunity. We don't really know what does this mean for a lot of the private EMS organizations, but what we'll say is, they reference, geez, you could always give your folks access to a fitness club membership for like a Planet Fitness, $10 a month type of thing. Really, we're not really sure what this will look like, but just so you're aware, it can be something super, you can go ahead and install a gym, or you can just allow them, like I know some places say, hey, you can go out and walk around the perimeter of the property, for 30 minutes per day. And by the way, there are significant health benefits that have come out of that, right? Rather than us being in a recliner. Although most of our folks, frankly, are on the road all of the time. How this is going to work from making sure they have time to do it, I don't know. That will, of course, involve cost as well. That, again, could be another item that we comment on. So these could be resources on the health and fitness, like resources that are available on the internet about sleep, about infectious disease management, about stress management. Again, there are probably cheaper ways that you can do this, or more economical is the right way to say that. Cheaper sounds bad. Economical ways to do this, but there also can be, certainly you can put in a gym, get gym memberships, you can do a whole bunch of stuff. Training, you are going to be required to not only furnish initial but ongoing training for each level of the job that your folks perform. So that would be different for an EMT than for a paramedic than for a dispatcher. Now, you have to have annual skills checks off. Now, probably a lot of our folks aren't doing that, and there will be a cost related to that, right? You're going to have someone to do those annual skill check offs. And What we're trying to ascertain are what are those costs that they're expecting, because OSHA has said, we really want to hear from you to get an idea of how this is going to impact you as an organization. Now, again, one of the things that they talk a lot about in here, and it's very clear to me that they are keyed in on this, is proper use and fit of PPE. I will tell you that and this is one that I give all the time. I see ambulance services driving by me with where EMTs and paramedics have beards. What I will tell you is that unless those folks have PAPRs, there's no way they are in compliance with the OSHA N95 standards. Now, what I tell people are, one, OSHA people live among us and they do drive around and see us, number one. Number two, they can fine you. Used to be if you had 10 people who had beards and they weren't in compliance with the N95 mask fit procedures, that you might get one fine of $16,000 or $17,000. Now what they will do is fine you for each individual for each day. So those fines can start to rack up. While your people love to have their beards, the fact of the matter is the law is very, very clear that that they are very serious about the airborne and bloodborne pathogen standards. Now, you are required to do a facility vulnerability assessment. Now, as I said earlier, this is largely geared towards those manufacturing plants or those organizations that have their own workplace emergency response teams. But that does not mean that this doesn't apply to emergency service organizations. You have to go through your building. This is already required, and identify what those potential risks are. If you don't have an inspection form, you should have one that you keep on record so that monthly someone's going through and conducting inspections. This not only includes the building itself, but its surrounding structures, surrounding locations, any potential. If you are in a particularly difficult area and your folks could potentially be assaulted on their way into work, you would want to be able to create some protections around that, lighting, maybe fencing, etc. So these are things, again, that you make sure that you understand that you're not just looking physically at the facility, that you're looking at also the nearby sort of area that your folks will be interacting with as part of their job. Now, it's anything that might adversely affect the health and safety of your folks. This includes things like critical infrastructure, water, electricity, communications. Now, you may not have a generator at the location, but you should at least have emergency battery backup, emergency lighting. Now, you also have to go through, make sure that your exits are appropriately marked, that you have exit plans or evacuation plans, that you have emergency lighting. All right. These include, by the way, things like making sure you have decontamination areas. Now, one of the things that they're really clear about is they want to make sure that vehicle exhaust is not making it into the living quarters of the station, that the vehicle exhaust is staying in the garage or getting exhausted out of the garage. This is why most fire departments have Plimo vent systems. If you don't have a Plimo vent system, may have one of those big, 2-foot by 2-foot fans blown through the side of the wall that activates when the carbon monoxide builds up or the exhaust builds up or whenever the garage door opens. Now, in some places, as long as the garage door opening is at least 1/3 of the square footage of the garage floor size, then arguably you don't require active ventilation, because the garage door opening, they say they'll be passive. Now, you may want to create policies that say, hey, listen, no vehicle gets started until the garage door is open, and the garage door is programmed to stay open for a minute after the vehicle leaves the building. You're going to want to set up policies around that. Most garage door openers now are programmable, and you can set them up so that not only will they not go down on the garage, but they also will close after 1 or 2 minutes. These are ways in which you can do it relatively cost effectively. You are going to have decontamination areas. So most of you do, where you decontaminate equipment, but also PPE or any gear. So storage and gear. So if you're a fire-based agency, you wouldn't want your fire department gear going into the living areas, because not only is that gear potentially problematic, but the stuff that's on that gear is potentially problematic. Same can be said for your folks in their uniforms. If in fact they have any contaminants on their uniforms, you have to have a place where they can, that uniform, the contaminated uniform, can be decontaminated, and your folks can get cleaned, disinfected, and then wear a uniform, and that stuff stays isolated. All right. You also have to have SOPs for decontamination. Now, this is a big one. And I know for some of our listeners that they say, well, geez, we haven't opened a station that has sleeping quarters that hasn't had a sprinkler system in the last 10 years. Great, wonderful. But for many others, starting within 2 years after the rule becomes final, you will have to have a sprinkler system in any building that has sleeping quarters. Now, that's not just new construction, not it's for new stations. So if you have an existing building that's in place at the time that the rule passes, that's fine. You do not have to put sprinklers in them. But if you open a new station after the rule passes, you have 24 months to get a sprinkler system installed in that building. So even if you're renting from somebody else, you're not going to be able to rent from that person if it's not going to have a sprinkler system in it, or you're going to have to convince that landlord to put their sprinkler system in, which they're not going to do probably. But just so you're aware, any station that has sleeping quarters in it that is opened with, and it's from the law passage until 24 months, you have to be in compliance to have a sprinkler system in there. Every single station, regardless of whether it's new or old, will have to have interconnected hardwired smoke and carbon monoxide detectors with battery backup. All right, so just to be clear, interconnected hardwired smoke detectors, battery backup, carbon monoxide detectors. Why? Because obviously they want to make sure that these are not, and by the way, I do not believe unless they are hardwired, so not even some of the web-based ones that might be out there, I do not believe that that's considered to be hardwired. So you're going to want to make sure that you have that, as well as doing, if you have some of the garages that I've worked in, by the way, have a carbon monoxide detector, and the second it senses or reaches a certain level, it kicks the thing on. So again, another requirement will be that you have vehicle operator training. This includes for any type of vehicle they may operate. If it's a Segway, if it's a 4x, if it's like a side by side, if it's a Gator, if it's a golf cart, if it's a boat, if it's a bicycle, they have to have training for using that vehicle. Type 1, type 2, type 3, fire truck, doesn't matter. They're going to have training on how to use that vehicle. They didn't specify how long that training has to be. It just has to be a vehicle operator course, including SOPs for vehicle operation, which means both emergency and non-emergency, what the SOPs are. What do you do at stoplights? What do you do at intersections, divided highways, railroad crossings, emergency devices, vehicle backing and spotters? So basically a comprehensive vehicle operations SOP and training program. This is one that I know 99% of the time, 99.9% of the time, all occupants in a vehicle can be belted, even with patient care. OSHA is getting very serious about this. What they've said is each position within the vehicle has to have a seatbelt or a harness, and there must be an SOP that says the vehicle doesn't move unless the occupant is seatbelted. Now, they sort of left a little wiggle room in there in the event that for some reason you can't be belted. But truthfully, with compression devices and all the things out there now, there's really not a lot. And I worked that truck for 30 years. Like, there is not a lot of time when you can't be seatbelted. In fact, the reality is most of the folks who get killed, the majority of people that get killed in ambulance crashes are unrestrained EMTs and paramedics. So this is something that is preventable, it is predictable, and I will tell you, there's literally no reason that folks aren't seatbelted most of the time. There are also policies around if you have or allow people to respond to a scene in their personal owned vehicle. You will have to have policies around the personally owned vehicles, because you as an employer are responsible for what happens to them while they're responding to the scene in their personal vehicle, as well as stowage of equipment. They are saying essentially, hey, if it has a manufacturer's bracket for mounting, that's what it's got to be in. Otherwise, it needs to be secured appropriately. The sense I have is they didn't say that it couldn't be strapped to the bench, but my sense was that's not what they're looking for. So you will have to have policies around safe roadway incident operation. This will include vehicle backing, vehicle placement, so that there are people blocking from the perspective of whether it be fire apparatus or police or however. You have to have policies. Now, you may need to work with the other responders to ensure that you have these policies covered, but establishing a safe work zone. We've had a couple of paramedics and EMTs get killed by being struck by vehicles over this last year. This is something that is largely preventable. That being said, I go by motor vehicle crashes all the time, and almost nobody's wearing the ANSI high visibility vest. What I will tell you is that is a requirement. It has been a requirement for over a decade, actually over 2 decades. There is no reason why any one of our responders are not wearing those high vis vests. That is required. But we talk about first arriving vehicle, how do you place the vehicle? Second arriving vehicle, how do we establish a safe work zone? And coordination with law enforcement. Now, they talk a lot about planning in this document, pre-incident planning, right? We know we're going to respond to motor vehicle crashes. We know we're going to respond to roadway incidents. We know we're probably going to respond to fire standbys. We know we're going to respond to single family home. Like, these are things that we can plan for, and we can even identify what those vulnerabilities are in those settings. And so when we can, we have to. OSHA's made it clear. No more can you say, well, geez, we didn't know. Yes, you did. All right. So, I mean, because it's sort of stereotypical, you may end up in a triple decker in a dead end in a cul-de-sac, and you at 2 a.m, how can they safely perform their duties in that area based upon the type and level of service? And then what resources, if you in fact don't have the resources, but your folks need them to safely operate, where can you get them? Hey, we need law enforcement, or we need fire for extra lifting or for just additional assistance. How do you get those? Your plan is going to have that in there. Now, we often call this the Incident Command System, the ICS. They are referring to it as IMS, which is essentially the same thing. So they say that you must have or utilize the IMS system, which is really, we know that all responders have to do ICS 1 and 7. And if you're in supervision and all, you're supposed to do more of those programs, right? Although I still see a lot of EMS agencies who don't make sure that all their folks have 1 and 7. In any event, you're going to have who's going to be the incident commander? Now, it doesn't have to be one person. It can be the first supervisor, the first battalion chief, whoever it is. That'll be our incident commander. They will be responsible for management of the incident safety. There'll be management for. Now, you can assign the incident manager can assign aspects of roles like safety and or staging, like we normally do at large scale events. You might set a triage officer, etc. But you're going to have to make sure that it's used at all incidents, and that in fact you've established that you've done some sort of scene size up, and that you're looking for any resources that you might need, and ensuring that anybody who's operating on that scene has had appropriate training. You have to have a decent communication system. Despite the fact that 9/11 occurred 23 years ago, we still have incidents where different agencies cannot speak to each other. Blows my mind, but it still happens. Again, we have more ways to communicate today than ever, but we're still awful at communication. So you have to have a mechanism for each member to communicate with the incident commander or the unified command system to, what's going on, what's happening. That can be a portable, it can be a cell phone, it can be face-to-face. I will tell you, cell phones are really challenging to use at scenes. One, they don't tend to open up with rubber or latex gloves on, or not latex, the vinyl gloves, right? So you just have to understand that don't rely on somebody's cell phone. They probably should have a portable. We had one of our employees get locked into a closet for over 30 minutes when their partner went downstairs to get the stair chair, and that person had no portable, had no ability to tell dispatch that she was in trouble. Thankfully, we got her back safely. But again, really, one of the reasons CAS is standard is each person on the truck has a portable, or because it's a push to talk and you can get instant response. This is one that we focus a lot on in fire, Mayday procedures, right? We focus a lot on it in fire because it is a high acuity, low occurrence event, right? There's very little things that I learned when I was a firefighter, but I still remember all of the procedures for calling a Mayday, right? My suggestion is talk with your fire department friends and have them talk you through exactly what it is. Why? Because if your firefighters hear the same Mayday signal for your EMS folks that they might hear for a firefighter, again, more hands are better, right? It's, who is it? Where are they? How, and are they going to attempt self-rescue, or what kind of help do they need? Again, make sure you have Mayday procedures. I don't know of very many EMS agencies that actually practice this, and this is basic common sense. You do have to have, and this came out before the, all the stuff that went down with Aurora in Aurora, Colorado, with the interactions with law enforcement, but you should have policies and standard operating procedures around operating with law enforcement because it is predictable. You are going to end up in incidents where law enforcement is engaging someone who may be violent or someone who may be resisting. Again, make sure you have policies around that, including things such as active shooter, right? I know Stephen Stevens and I are doing a session this year at Annual, which comes up next week. By the way, if you haven't registered, you should. And we're going to do a session. And one of the interesting things that Steven said was, geez, we had done MCI drills, but we'd never done an active shooter drill. And of course, Uvalde EMS had one of the worst shootings in this country's history. But again, this is one of those things that, right, we probably should be drilling at this point. If you're in a state or a town, I know my fire department did a drill this whole weekend, an active shooter drill in our high school all weekend long for literally 2 days, right? It's one of those things. And guess what? It probably still will be rough if, God forbid, it ever happened, but at least they would have practiced. And, again, it's one of those things, high acuity, low occurrence. You need to practice it often so that it becomes reflexive. Fire service is real good at doing firefighter rehab. So when they come out to change out a bottle, somebody takes their blood pressure, gives them water, make sure that they get rested so that they're refueled and ready to go back in, or maybe they can't go back in. We don't do this in EMS. So if we're at a long-standing event where maybe they're exposed to extensive heat or extensive cold, we should probably have some sort of rehab process where we can go through, assess our folks' health and ability to continue to do the duties, and then either send them back in or not, but something like that, right? Real good at doing it in fire, not always so good in EMS. Following any event, you have to have a post-incident analysis. By the way, this also has to be documented, really, to determine what was the effectiveness of our response plan. What was did we identify that vulnerability? Did we identify, the risks associated in there? Did we respond? Did it work the way it was supposed to work? Now, we're real good at doing this during drills or really large-scale events, but again, we tend to drill once or twice a year, right? Would you want the cardiac surgeon that's done it once or twice a year? Probably not. So this is the kind of thing that needs to become part of your organizational mantra, right? We're just doing this stuff as a regular. You're looking at the risk management plan. You're looking at the incident management system. You're looking at your post-incident, your pre-incident plan, et cetera, and your SOPs. Like, did this go the way we thought it would go? You do have to have policies around standard operating procedures around non-emergency stuff. Because by the way, a fair chunk of our people's injuries occur not during emergencies, but during non-emergencies. And so it's important. And by the way, even those emergency resources spend probably 50 or more % of their time doing non-emergency related stuff. So you should have standard operating procedures around non-emergency. So this was intended to be a very, very, very high level overview. What I will tell you is, as we move further down the line of this process, right, as I said, June 21st is when the deadline is for the submission of comments. As we get further down the line and we learn more, we will, of course, provide more education and resources. Now, regulation implementation for the timeline. So for some of the things, it's going to be 6 months. You can see what those are. Others will be 12. And then yet the harder, what I perceive to be probably more difficult ones, such as fire suppression symptoms, fire suppression systems, annual skills checkoff, vehicle training. Again, those will be 24 months after the rule is finalized. We don't know exactly when the rule will be finalized, right? The initial comment date was May 6th. It got extended to June 21st. Now, what I will tell you is all of the groups were asking for a 60 or 90-day extension from May 6th. What OSHA did was 45 days. In my estimation, that tells me that they are anxious to get this rule implemented. So, but they are also, and they have been very open that they're seeking comment and input from all of the stakeholders in both fire and EMS. Right? They want to hear, did we include enough? Did we put too much? If so, why? So it's going to be important that you talk with all of your stakeholders. As I said, the comment deadline is June 21st. Now, please, the link here in this, and I sent the slides to Sam, and she has them. She'll be sending them out, and the link is there in the chat. The link is active, and it will take you to the comment submission portal. Please, please, please do not. There are probably, I didn't look today, but there were well over 500 comments last time I looked. And probably the majority of the comments were, this is crazy, you're going to put us out of business. Now, I worked at the Department of Labor for a couple of years, and what I will tell you is the last thing any regulator, person who's decided not to go into regular private business and make more money, they decide to go into federal government because they believe they want to make a change. After working on a rule for 10 or 15 years, wants to hear is, this is crazy, you people are out of your mind, you're going to kill us. Because in their mind, they're thinking safety is something that all employers should be doing, right? So this is crazy, it's going to put us out of business, not useful. Something like, hey, the additional requirements for the physical fitness or the physical evaluation requirements, not only does it add an additional $100, $200, $300 to our average $400 medical evaluation, but having to do every single person every 2 years is going to add another $100,000 a year, which for our organization, whose total operating budget is $150,000, is really going to injure our ability to respond to emergencies. That, to me, is something that is more likely to gain the ear or attention of a regulator than, this is crazy, you're going to close our doors, because there's not one federal regulator that wants to close your doors. They want you to get safer. So please, 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 what I would ask is that we're working on a comment for the AAA. I'm sure the PAW board is working on a comment as well. What we're going to ask is that you do engage. It doesn't have to be a professional lawyer writing your letter, but that you be thoughtful and considerate of the fact that they've been working on these for a long time, and that you want to put numbers and data behind what you're saying. So if you have questions, as Samantha said, you can submit those questions to admin@paawpaw.us. That's perfectly fine. You can also submit them to me. I've got both my email and my cell phone number up there. If you text me, please include who you are, where you're from, because otherwise I will spend like 30 minutes thinking that we should know each other. And then if we do know each other and I don't know that that's you, I'm going to feel awful. And so please just text me, tell me who you are, where you're from. And then if you email me as well, I'll have your email, but please don't be afraid to say, hey, I work with so-and-so. Again, admin@paw.us is where you can go for questions. Sam has the slide deck in the chat where you can just download that slide deck. And let me see, we have a question from Mike. What would the definition of a volunteer be for someone who would not be covered? 100% volunteer, stipend per call? So that's a really great question. So you want to be really careful, because a lot of people call people volunteers. Now, there are two agencies, both the Department of Labor, United States Department of Labor, and the Internal Revenue Service, who govern whether somebody is a volunteer or not. Now, a volunteer under the Department of Labor's definition is people who are not functionally paid for the work that they furnish. Now, by the way, a volunteer, and we did a webinar, I don't know if it was from Minnesota or where it was, we did a webinar on volunteerism as a general rule of thumb and what the rules are regarding who is and who isn't a volunteer. Department of Labor says, hey, if someone's uncompensated, or really what they say is if someone's paid below minimum wage, then they are a volunteer. The reality is there are lots of people who may be paid below minimum wage. They just might be working for employers who are totally violating the law. But really, the IRS's definition is functionally a volunteer cannot earn 20% or more of what you would pay an employee to do that work. So if you're stipending a volunteer an amount that would functionally equal 20% or more of what you would pay an hourly based employee to do that, well, then that person's probably an employee, and you've got a whole host of other regulatory obligations in there, such as reporting taxes, such as, there's a whole, like you have the unemployment, you are transitioning from a volunteer organization to an employer. And so there are, my estimation, this is probably a pretty significant compliance issue. So 100% volunteer is someone who's not getting paid to do the work that they're doing. If you are paying people, you're going to want a lawyer to look at what you're paying to make sure that you're not going over. Less than minimum wage, just so you know, is sort of the DOLs, that's their easiest definition, but let me just be clear. Understand that the IRS says, hey, if we're paying less than minimum wage, well, just so you know, it's got to be at least 80% less than minimum wage so that you're under, actually 81% less than minimum wage. Why? So that you would then fall under that 20% that the IRS both govern. So don't think it's one over the other. You're going to want, if you are paying a stipend or you are paying anything to a volunteer, you're going to want to have your accountant and probably an employment lawyer take a look at what you are paying, because those folks may or may not actually be volunteers. And then if they aren't, well, there's a whole host of other things that are going to apply. So great question, Mike. Thank you for the question. That being said, the QR code will get you to my website, which then you can reach out through a contact form if you want. But I think I don't see any other questions. And I'm just double checking to check the chat and check the Q&A, and I don't think we do. So I know it was a fire hose. I know you had to drink from it, but we will answer any questions you have. You can email me. You can email the admin at paw.us, or you can reach out to Samantha Hilker, of course, who is unbelievable. So I'm going to, with that, hand it back 5 minutes early to Sam. Oh, wait a minute. What about the requirement to care for PTSD? So Bob, good to see you. The PTSD part is part of that those mental health resources that you have to make available to your employees. And that includes diagnostic assessment. It includes counseling. It includes a whole bunch of stuff. So again, it's sort of not just PTSD, it's any behavioral health. It even includes things like resources for sleep deprivation, for for stress, etc. Now, those things can be things that are available on the web. They can be things available through your health plan. That's fine. It just can be no cost to the employee. So great question, Bob. Thank you. Any other questions? I don't see any others. So with that, I'm going to pass it back to Samantha to close us out.
Thank you, Scott, for your time and for sharing all of this information with us. As a reminder for all of our attendees, this webinar will be recorded. It has been recorded and it will be posted on our website within 24 hours. Feel free to share that recording link with your friends and colleagues and neighbors. Make sure everyone who needs this information has this information. And as Scott mentioned, the PAW board is working on drafting a comment letter for this proposed rule. If you would like to draft a comment letter as an individual agency or as another group or association and you'd like help with that, please let us know. We also ask that any agencies who are drafting an individual public comment letter, please share that with us so we have it for reference as well. Thank you again for all of your time today, and we will see you next time.
Thank you.